everyone. I hope you're all having a wonderful day. My name is Siddiq, and I'm the coordinator of Alfaisal MedHub under the International Office at Alfaisal University, Riyadh, Saudi Arabia. I'd like to welcome you all to yet another exciting webinar under the Career Guidance Series, UK. For those of you who don't know what Alfaisal MedHub is an initiative under the umbrella of the International Office, College of Medicine, that aims at creating an online global community of medical students. Alfaisal MedHub covers a broad range of topics that are common to medical students all around the world. Our primary objective is to help medical students learn more about their career opportunities available after graduating, as well as the steps involved in pursuing them. Since medical students are always confused about the path that's ahead of them, Alfaisal MedHub's Career Guidance Series addresses this challenge from the perspective of accomplished and experienced seniors. As you're all aware, we are now conducting the Career Guidance Series UK for all medical students, and this is in partnership with AMBOSS. We are excited to introduce to you Dr.Lin Tuleimat, who will be delivering the second webinar under the Career Guidance Series UK, titled The Application Process, Applying for Jobs and Interviews. Dr. Lin is an MBBS graduate from Alfaisal University, who holds a master's degree with distinction in clinical neurology from the University of Sheffield, United Kingdom. She's an aspiring academic neurologist and is currently an internal medicine trainee/resident at King's College Hospital in London, United Kingdom. Her interests include continuing experience in research, teaching, and quality improvement. Thank you for joining us today, Doctor. We are looking forward to this webinar.
Good afternoon, everyone. Thank you so much for the introduction and for all your efforts. Today, as Luqman has said, we're going to be discussing the application process and applying for jobs and interviews in the UK. So we're going to start off from the very beginning, EPIC verification, because that's the first thing you need to do before you start to apply for registration or do any licensing exams to join the UK system. So for the EPIC verification, there are various steps that you need to be aware of. And I'm also going to discuss whether it's possible or not to actually do an FY1 in UK, even if you didn't have your MBBS as well. So in terms of the steps that you need to do, step one would be you need to read the registration information on the GMC website and check the qualifications you need to have verified. Usually, the only document that they need verification for is the MBBS. So you just need to send that through to them. Obviously, in cases where you're still a fifth-year medical student, so if you don't have the final medical diploma, you fall into one of these categories below. So there are doctors who has recently graduated and the diploma is not issued yet. You can get a graduation certificate or letter issued by the medical school that you have finished every requirement that needs to be done to get to the medical degree. In more detail, this I might be able to cover for you in the next session that we're going to do, as I need to confirm also with the GMC. In that case, if you do give them a letter from the university, whether you would be able to actually do an FY1 job even before receiving your MBBS, because you have finished all the requirements. So I'll discuss that in further detail once I get all the information that you need to know. In such circumstances, if you have lost your diplomas, then you can obtain a duplicate diploma from the medical school or the university and you submit it to EPIC. If there are any doctors with refugee status, they may also submit a duplicate diploma. They can also submit a graduation certificate or a letter issued by the medical school to confirm that they have met all the requirements. So that's the first step, get the MBBS sorted. And if not, then a letter from the university should hopefully do. That also, as I said, make sure that it covers that you had all the requirements. Step two would be to set up an online account on the EPIC website, and that is very straightforward. You just fill in your details and you get an EPIC account. And after that, you log in and you upload your required qualifications, which is the MBBS, for a verification. And you need to select the General Medical Council so that you can to receive the EPIC report for that qualification, which goes directly to the Medical Council after all the process has been done. That basically ensures that the GMC is updated once they have done all these checks and everything is okay. And after you do that, you submit your application for the registration to the GMC and you provide your EPIC ID to the GMC. Obviously, you won't be able to submit the application to the GMC until you had a confirmation that your primary medical qualification have been sent for the verification. Usually, you will get an email from ECFMG that confirms that they have received it, and then you can check the status by logging into your account. Basically, it might take some time because it goes to our university so that they can verify it, and that's usually, I don't know if it has changed, but it usually gets sent to Dr. Abdurrahman Oban, who verifies it, and then it gets sent back, and then once it's verified, then the GMC received the report from the EPIC, and that will give them a report. And then, as I said, you just need to give them the ID, and then you can start the registration process on the GMC website. As you can see, we were going to be sharing with you these slides. This is the link below where you can know the instructions in detail and you can do the process. And you can contact them if you have any further questions. So that would be the EPIC verification. If you have any questions about this first step, you can ask me now. Otherwise, we can move along to the next step. So the only question I see on the chat is, can you do this this before internship once you graduate? So that's the thing I need to make sure from the GMC, because I heard it's possible. It's just I need to verify it with the GMC, so I don't give you any information that I'm not really sure of. How much does it cost? From my memory, I think it was around 70 to 80 pounds, so not really a lot, because it's also one document. Usually it differs with different councils, but with the General Medical Council, it's not usually more than 100 pounds max. Do you know who should issue this letter from the university? Basically, once we do this, it gets submitted, and then our university, usually Dr. Abdurrahman Oban, will go through that verification process, verifies and sends back to the EPIC administratives, and then they can verify accordingly and send the reports to the GMC. Once that's done, you can just start registering yourself on the GMC website. Okay, any further questions about the EPIC verification? Okay, if there are any further questions down the line, you can obviously ask me after we finish. But as I told you, we'll do that. We'll cover one topic, you'll ask me questions. Any further questions towards the end, we can also answer them, no worries. Okay, so step 2 would be the English language tests. And I will discuss different requirements according to which pathway you're going for, but generally speaking, just from a registration perspective, you need to have either IELTS or OET. For IELTS, you at least need 7 as a score in each testing area and an overall score of a minimum of 7.5. Generally speaking, because I've done IELTS myself, a lot of people have opted to go for OET. So I wouldn't be able to answer a lot of questions about OET per se, but I can tell you what the requirements are. But from an IELTS perspective, to be honest, it's very easy to score more than 7.5 in each section, except for the writing. And for that, if people want to opt to go for IELTS, I would recommend that you go through the Barron's Handbook for IELTS, because they can give you, because that's the only thing you need to practice, to be honest, writing, because they look at a specific writing way and use of certain vocabulary. So if you are aware of, templates of what they are expecting you and the templates that would get you higher marks, this is all present in that Barron's Handbook. if you read through them and you know what the pattern is, you will actually be able to get a 7 in the writing. It's not that difficult. It's just you need to review from the correct resources and know what their expectations are, so you know how to do it in the way that would get you the mark that you need, which is 7. From an OET perspective, if you want to opt for that, you have a minimum of grade B in all areas to pass the exam. If it's a point-based, because they do it as a point-based and as a grade, a point score would be 350 points across all areas of the test. Once you get that, you'll easily just get the registration sorted, and then you will be able to apply for the exams, which is PLAB 1 and PLAB 2 respectively. It's important to know that you cannot apply for PLAB 2 before PLAB 1, so you need to finish PLAB 1 in order for you to start PLAB 2. So that's from the English language perspective. If you have any questions as well, please pop them into the chat. One question is, do you still have to do IELTS if you are UK born? My understanding is if you have studied anywhere outside UK or Europe, you do have to do this. Other people who have, my understanding, even if you're born in Europe, you can actually skip the IELTS, but if you're born in UK, if you studied outside, you can't. I don't really understand why that is, but even if you're UK born, I think you have to do the IELTS if you studied outside your entire life. Unless, again, things changed recently. I'm not aware that there has been any changes, but that's what I know from people with similar experiences. So people who had European passports were getting in without all this hassle. However, people who had a UK passport, they needed to go all these steps, including PLABs. Any other question in terms of the language test? Okay, so we're gonna move to the next step, which is the licensing exams or the board exams, because there are two pathways actually to get the GMC registration. Pathway 1 would be the PLAB exams, and that mainly you can do, obviously, if you're a fresh graduate or not a fresh graduate, but this is more suitable for the fresh graduates. The pathway, second pathway, which is the MRCP or the MRCS, and these are board exams in comparison to the PLAB, which is a licensing exam. This requires you to have years of clinical experience. So there are people who have worked for 2-3 years in another country, and they want to get in as a specialty registration rather than general registration. And that can also get you the registration. It's just at a different level. And even when you do this, you can start at any level in terms of jobs. It's just, this is another pathway to get the registration. We're going to discuss each of these in detail and how can you ace them and when is the best time to do them, how much to prepare for them. But just that you're aware, if you did work for after graduation for 2 to 3 years, you'll actually be able to do MRCP and MRCS. However, it requires you to also be aware of the UK system a little bit and their guidelines, because these exams are testing your knowledge in the UK guidelines. Obviously, there are general questions where it's the same throughout any kind of country, whether it was UK, US, but you need to know some specifics about the guidelines in the UK to be able to ace these exams. So you can apply for these. MRCP Part 1 is mainly basic medical information. So it's kind of similar to Step 1, USMLE in a way. And that should be straightforward. If you've studied for USMLE as well, that could be very straightforward for you to pass. But obviously, you need to know a bit of a background about the UK guidelines. MRCP Part 2 is very clinically oriented, and it mostly represents Step 2 CK. And basically, that requires a very good knowledge of what the UK guidelines are. Having said that, it's not really difficult to pass these exams if you haven't worked in the UK, but it's better that you either have worked in the UK or you have read through in the Oxford Handbook and the NICE guidelines, which are the guidelines for the UK system, clinical guidelines. So if you are, reading through these from the beginning, it will be easy to pass these two. PACES, which is the OSCE exam, would also be testing the guidelines, but would also be testing the approach to the patients. That, again, is not very difficult if you have years of experience, but it just requires awareness of the system. As long as as you're working, you are actually reading, for example, the guidelines from the NICE guidelines for UK, you'll be able to pass these exams. But as I need to stress that it's very important to be aware of these guidelines, because if it makes it otherwise difficult to pass these exams with good score. This exam is a pass or fail. You will have a score, but the most important thing is a pass. They will not look at the score, and having a higher score doesn't really add to whether you'll get, specific, or you'll get, more competitive if you have a higher mark. That's not really what they look at. The most important thing is that you have passed this exam. And that applies for also MRCS. MRCS will be discussed by my colleague Abdullah Shammari in more detail, because he's the surgical trainee here. But generally speaking, this applies for both of these tests. Just have a bit of a background about the guidelines of UK if you want to go through this route. And you have to have at least 1 year postgraduate experience in order for you to be eligible to apply for part 1. So again, put that in mind if you want to pursue that pathway. Obviously, I'm going to mention that in detail, but if you have one of these, if you wanted to do PLABs and you managed to get one of these exams from the MRCP or MRCS done before applying to the training, that does add to you that you have finished one exam before even starting training. So that's also something to look at and to prepare for when you are, applying for jobs, and while you're doing the job to get to the training pathway. Okay. In terms of questions, write the handbook title here. I'll do that. So I'll do that towards the end. It's the Oxford Handbook of Clinical Medicine. If you read through that, will give you a very comprehensive idea about the system. Would doing a 1 year in internship be considered part of the second pathway, or only 2 to 3 years? So you will be eligible to apply for MRCP Part 1 if you have at least a 12-month experience. Obviously, after that, once you do Part 1 and you're still working, that will add up to you. And I think after that, you will be able to apply to Part 2. So, but it needs to be at least 1 year for you to be eligible to apply. For passing the exam, now this is from eligibility perspective, but for passing the exam perspective, I think it's better to have at least 18 months to 2 years experience, so that you find studying the exams easy and straightforward and you wouldn't be overwhelmed. Because otherwise, if you don't have that much experience, it might be an overwhelming exam for you. These exams are not really difficult to pass if you have, a good experience. So that's why I said 2 to 3 years. And because a lot of people actually come after 2 to 3 years and they do the PLAB pathway, but they can also alternatively do the MRCP pathway in that case. Eligibility wise, 1 year for you to easily study for the exam in a couple of months or 3 months, 2 to 3 years of experience, because that can give you an easy way to study it and finish it. Can I have clinical experience and only do PLABs? Of course. No. I'm telling you the different pathways where you can apply for registration. You can have clinical experience and do PLABs if that's something you want to pursue. And you can also do these board exams. So it's just 2 different ways of approaching the registration. But as I told you, when you have these board exams, it looks good on your CV, especially if you have not started training there yet. However, it's completely up to you of what you feel comfortable starting with or studying for. Sometimes PLABs, to be honest, PLABs are a lot straightforward than board exams. So it will be easier for you to study and do these exams rather than going for a board exam, which actually requires more experience and more time to study. So it's honestly how you want, or what kind of time restraint do you have? When are you planning to go? Are you planning to go directly into specialty training if you've already done, like, for example, 3-4 years of internal medicine somewhere else, and you want to go directly for a specialty like neurology, cardiology? That's another pathway that you can use. So it's just how your priorities are. What are you planning to do when you go there, rather than if you have clinical experience, go for this, or if you don't have clinical experience, go for that. It's a preference depending on your personal circumstances. Is there an expiration period on board exams? In a way that it's similar to USMLE. So you have to have finished all these exams in a 7 years period, because if you do MRCP part 1 or part 2, and then you didn't do any of these exams for 5 years, 6 years, and then you want to apply again, you have to have this, time restraint in mind. If you don't finish all these exams in 7 years, this becomes expired. So you have to finish them all within 7 years. But afterwards, obviously, there is no expiration. If you do them all, you'll be board certified in internal medicine. But if you don't do them within 7 years, then you might need to repeat, basically. Any further questions? After I go, so I'm trying to just outline to you what you need to do to get into the system and start a job. Towards the end of this talk, I can discuss with you in detail, if you want, how to prepare for the board exam specifically. I will now discuss the PLAB exams, but if you want to know a bit more about how to prepare for board exams, I can also give you a bit of an idea about that, so that you're aware what are the resources that you can work with. Okay, so the PLAB, which is short for Professional and Linguistic Assessment Board, you have 2 parts, PLAB 1 and PLAB 2. PLAB 1 is basic MCQs, and PLAB 2 is an OSCE-based exam. Now, in terms of how to prepare for these, basically the sources that you see here, they are actually for both PLAB 1 and PLAB 2, but I would say the main resource for PLAB 1 to start studying from is a website called PLABable. You study the questions that are there, because they have, it's more or less like the UWorld. So they have all the questions with explanations of the answers, and then they have mock exams there that you can do, so you can see how you're progressing. And then there are these resources. I would say these complement. The main thing is PLABable for PLAB 1, but Swami, Samsons, and Aspire, they complement. So if you actually do them, that will almost guarantee that you get through the exam with very good marks. From my personal experience, I did PLAB 1, I studied for PLABable, and I then did the Swami. I didn't do the actual course, but Swami also offers mock exams. So they basically give you a mock exam, and then they give you like 3-4 hours to do it, and then they start discussing the answers and why, and it becomes basically like a discussion-based talk that also lasts for like 3 hours. So they discuss all the questions, so you know, why was this wrong, why was this right. So my personal experience was Swami, and to be honest, Swami offered something that will help with the exam, which is, one, they show you all the repetitive questions, whether it was in PLAB 1 or PLAB 2 that comes. And it also gives you more of an idea about what's the level of the difficulty of the exam. So PLABable is more like you're learning about the information. It's all very detailed there. But if you want to know how the exam difficulty is, or what kind of questions actually come, the style is very similar when I did the SWAMI mock exams to the actual exam. And it kind of prepared me for the level of difficulty. It then becomes up to you whether you actually want to attend a PLAB 1 course where they go through all the medical concepts that you need to know in detail and the UK guidelines. There is a complete course for that. And it's very helpful if you want to have a much more comprehensive idea about the exam and the information. So again, I'm just making a comparison with the US because this is also a known one. Kaplan courses in US, this is somehow similar. So they give you all the information that you need to do to ace the exam, basically. So this is something that you can attend, and that applies obviously for SWAMI, Samsons, and Aspire. And they also give you, as I said, mock exams so that they prepare you for the level of difficulty, the most recent questions that came in the exams and the ones that are being repetitive in the exams. I personally can speak from SWAMI perspective because I did SWAMI for both PLAB 1 and PLAB 2. I know some of the colleagues who went for Samsons or Aspire, and basically most of what I heard, but again, this is very individual, according to what you're expecting out of a course, to be honest. So for me, it was more important to know what questions came in the exam so I can concentrate on them, know what the difficulty of the exam is. So I went for SWAMI. Samsons and Aspire usually would prepare you well in terms of how you prepare for the exam, the information, especially for PLAB 1. PLAB 2, they would train you well on how to approach generally. They wouldn't necessarily have an up-to-date of what was the recent stations. I think each of these courses would supply you with something different, or their outlook on how to prepare you for the exam is different. Obviously, if you want more training on actually how to approach, what are the guidelines, rather than what were the most recent stations that came, then you choose alternatively the one that you feel that you require. Because each of them, I think, offers a different flavor to prepare for the exam. And I think each of us individually want preparation in different areas. So it highly depends on individually how you feel you want to be prepared, what are the things that you think you need to work more on. And based on that, you can do either of these courses. They're all really, really good. So I would recommend that at least you do their mock exams, any of them, because I've actually went through most of these three before I went for PLAB 1 and PLAB 2. They were all really, really good. But generally speaking, just know what you want out of the course, and based on that, choose what course do you want. You can actually take the mock exams for more than one. That can help you prepare better as well. And from a PLAB 2 perspective, basically they do a course which is around, I think, 10 days. And it's basically can be online, can be face-to-face. You can attend either. And it's a whole day kind of. So it's like 10 days, but an entire day of they're giving you lessons, stations, how to approach, what to say, what not to say, what are the guidelines, what are the recent stations that came. So it's very, very comprehensive. And they would supply you with all the details that you need to know and how you need to approach different stations. Having said that, I would kindly please ask all of you, because this is a mistake that some people might actually go through. Once you attend this exam, and I'm telling you this because I heard many people did that and problems happened after. When you attend these courses, please don't go to the exam having, especially PLAB 2, having memorized the stations and just basically repeating whatever you have learned. Have your own, because that can actually, let me tell you something, they're aware of these courses. They're aware that if you're coming and you're basically just, you know, regurgitating everything that you have memorized as a station and not actually have your own approach, your own style, your own way of thought process, if they don't see that, even if you're actually going in the right direction, they might fail you on the station just simply because they feel like you are basically just regurgitation. You're not actually having your own active thought process. That's what they want to see. They want to see your approach, your personal approach, and how you're going through it. Don't memorize stations and go and just regurgitate them in the exam. That's not going to be helpful for you at all in the exams. And I actually have heard feedback from people who did that and they thought they did very well at the station, and it turns out that they have failed them on these specific stations because they felt that they're not actually having their own, style. So be very aware when you prepare for these exams. These courses are very helpful to you to know what to look for, know how to prepare you in terms of guidelines and what are the things that might come, so you can prepare yourself from an information perspective. But please don't memorize a station and go do that in the exam. That's not going to be helpful to you. So that is from preparation for PLAB 1 and PLAB 2. If you have any questions on that, please let me know. How much time? So it depends if you are actively working or not. So if you're not working as you're doing these exams, I would say for PLAB 1, probably 2-3 months would be more than enough. For PLAB 2 would be, again, if we're considering that you're attending a course and you're practicing, I would also give it 3 months to be very thorough for PLAB 2. If you're working, it depends on how much time you can give yourself to study. But I would say make it 4 to 6 months, especially if you're only having like a couple of hours. Obviously, to be honest, it's really personal because, how you are, managing your time, how much time you're giving every day, how much background you already have. Do you need time to actually go into detail because you're not very familiar with this topic or that topic? It really varies. But I would say if you're not working 2 to 3 months for either of these exams, if you are working, then give it 4 to 6 months, so that I want you to be fully prepared. I don't want you to go to the exam, not be fully prepared for. So 4 to 6 months would actually give you a good time to prepare very well for the exam. If you're working and you're only studying, let's say, for a couple of hours every day. Do we need the EPIC verification for taking PLABs? As far as I remember, the registration process starts with that. So you need to do the EPIC in order for you. I might be wrong, it's been a while, but I remember I started off with the EPIC verification and then I proceeded forward with the registration. So I think that's the first step, and then you can take PLABs because they need to verify that you have finished all of this in order for you to start applying for these exams, basically. Okay, any further questions? What is the difficulty level comparing to step 2? To be honest, if we're just discussing, I would say, let me put it that way. PLAB 1 and PLAB 2 are not really very difficult. They're licensing exams. Basic information. In terms of difficulty, if I'm comparing PLAB 1 and PLAB 2 to step 1 and step 2, PLAB 1 and PLAB 2 are easier in terms of preparation. There are going to be some changes in the next couple of years of how they conduct these exams, and it's going to be named UK Emily instead of PLAB 1 and PLAB 2. There might be a few changes which they haven't actually discussed yet of how it's going to be, but there are going to be few changes on how this exam is conducted, what is the expectation, but I don't think it will be largely different, but there will be some changes. But definitely these licensing exams, I would say easier to prepare in the fact that it's not going to be emotionally exhausting as the steps are, that's for sure. However, for MRCP, if you're planning to do MRCP or MRCS, I would say it would be probably of equal difficulty, if not more difficult. Because these are board exams, obviously, they're in internal medicine, and it requires you to have good experience, very good knowledge in the clinical guidelines, and you need to put time to prepare. Even if you have this experience, there are many guidelines that you need to be aware of, because the exams will be testing you on what is the immediate management, what's the immediate step, what do you do on the long term. So you need to be aware of that big picture and the clinical guidelines. So I would say PLAB 1 and PLAB 2, definitely much less exhausting to prepare. However, if you're going for board exams, they're definitely equal difficulty, if not more difficult, because there's a higher expectation of what you need to be aware of and what you need to know. So I hope that summed it up well. Any other questions? Okay, I'm gonna move on to the next slide, which is the MRCP and the MRCS. Now, as I told you, my colleague Abdullah Shamari will be discussing MRCS in further detail, but I will point some few things you need to be aware of about this exam as well as MRCP, because they share that in common. Now, these are the links that you can go to, and basically from there, you can apply for the exam, you can check what is needed, and you can see what dates are available. I can actually just go through one with you, just so you're aware. So as you know, there's MRCP Part 1, MRCP Part 2, and MRCP Part 2 Clinical, which is the PACES. Basically, let's go for Part 1, for example, which I think a lot of you would want to start doing. It's an entry-level exam, minimum of 12 months postgraduate experience, as I told you, and it covers a broad range of topics, ensuring the knowledge is appropriate. Basically, if we want, so basically here you can see the exam, they can give you a bit of an idea. Basically, this is a one-day exam, 2 3-hour papers. So the overall timing of the exam is 6 hours, and that applies for MRCP Part 2. And each of these papers will have 100 questions. So you have 100 questions in the first 3 hours, and then 100 questions in the next 3 hours. And usually it's best of 5 questions. There are sometimes images depending on the questions, but mostly it's not really. It's just basically they would give you a lot of labs and you need to go through that. Some questions would have images. And now, because of the COVID situation, they actually made it online/exam hall. So you can actually do it from your home. Obviously, you will have you need to set up actually your laptop camera, your mobile camera, because that's how they will be able to make sure that there is no form of, you're reading a book or you're, going through a website to check for the answers. That's how they're gonna protect this exam if it's online. Obviously, exam hall, you know how the situation is, but online, for them to ensure that there is no cheating or you're not opening any other resources, you need to set, and they'll let you know how to do it. You set your laptop, you set your mobile camera, so that they have a 360 overview of where you're sitting and what you're doing throughout the exam. Now, just so you have an idea, and this applies for all of these exams, you have, now it was 3 times a year, now it's 4 times a year because of the COVID situation as well. So basically, the first one would be in February to March, the second one would be in May to June, the third one would be in August to September, and then the fourth one would be towards December. As you can see, depends if you're in the UK or working in the UK, it's a bit cheaper than if you're doing it from internationally. It takes about 4 to 6 weeks to get the results. And basically that applies for MRCP Part 2 as well. Otherwise, just to get you a bit of an idea about PACES, it's a half-day examination, which is the OSCE, and it takes place in a clinical setting. It can be either in a clinical skills center or a hospital, and it assesses 7 core skills, and it has 5 stations and 8 patients encounter. So just trying to check, so the exam format, just so you're aware as well. So basically they have a 5 minutes interval between each station, and you have station 1, which is usually respiratory, abdominal, history, and examination and discussion, 10 minutes for each. Station 2 would be history taking, 20 minutes. Station 3 would be cardiovascular, neurological, again, 10 minutes each. And then they have a specific station just for communication skills and ethics, which you need to be fully aware of because there are a lot of ethical dilemmas and ethical situations that you would be having to deal with as you are progressing. Station 5 would be a brief consultation. It lasts for 10 minutes and they would give you different scenarios. So when I'm telling you the station has 2, they would give you, I think, 2 scenarios. And you need to go through them, including a precise history, examination, and discussing the workup, basically. I hope that gave you a bit of an idea about the exam itself. Having said that, these 2 exams, as I told you, the details of which for the surgery, it will be discussed by my colleague, but these 2 exams, if you actually do them before you apply to the internal medicine training or the surgery training, it really looks good because they know that you already started preparing for these exams prior to actually getting into training, and that looks good on your application. That might actually help you rank a bit higher. As I told you, the score itself doesn't really matter, but the fact that you have done these exams looks very good on your application. So if you want to be a more competitive candidate for the training, it would be good if you've actually at least done one part of this exams. I've actually known people who have done MRCS Part A and Part B completely before actually starting the training, the surgical training, and that made them a much more competitive candidate as well. It's not necessary, and I'm not saying if you don't do them, you're not going to be a competitive candidate, but I'm just giving you factors of what maximizes your chances of, one, being a competitive candidate. Why do you need that? Because you want to be accepted in well-known hospitals, because that honestly will give you a much more rich experience. The standard in terms of training is the same, but when you are accepted in highly rated hospitals, the support there will be a lot better. There wouldn't be any shortage of staffing, which sometimes is an issue. So the bigger the hospital is, the more likely that it will be supported from, what I'm talking about is clinical experience perspective. So it wouldn't be too overwhelming for you. But basically, try to at least do one part of these exams if you have time to maximize your chances. I'm going to discuss the matching process in detail afterwards, but this is just something for you to be aware of. If you do these exams, it will be good on your application. And in terms of surgery, as I'm sure Dr. Abdullah will tell you, it actually really maximizes your chances into getting into the training of surgery if you do MRCS Part A and Part B. And a lot of people that I know have actually done it, and it's not, you can hear a lot of people saying that it's very difficult to pass this exam, but it's just, you need to know what are the right resources, whether it was MRCP or MRCS. Use the right resources, have very good experience, you'll be good to go. For MRCP specifically, if you want to prepare for it, the best resources would be, one, your clinical experience. That really is very helpful. Second is using the question banks, the PASS medicine and PASS test are what I would recommend for you to concentrate on. PASS medicine is usually, and I'm going to put all these names, don't worry. PASS medicine is usually good from having all the information, so it gives you questions and answers again, and it goes into so much detail of why this answer is not correct and why this answer is correct. So it's very good for prep. And it also provides you with links to the clinical guidelines, to the videos that makes you understand the concepts better. PASS test actually has past papers, so they actually give you a taste of what the exam will be like. So they have past papers from 2014 maybe. So actually doing PASS tests after studying from PASS medicine will help you know at what level you're on, and or if there are things that you need to, you know, work on, study more. PASS test also has very, I would say the questions in PASS test generally are more representative of the difficulty of the exam, but PASS medicine gives you a very good background knowledge because it discusses all these concepts in detail. So that's why I think if you want to be very thorough and prepared for these exams and pass them from the first time with very good marks, try to cover both of these resources if you have time. Otherwise, I think complementing a bit of both, so doing PASS medicine for the knowledge and then PASS test with their mock exams and the PASS papers can be also comprehensive depending on your time. But I would say a lot of people as well have said that these two are the two resources that you need to rely on when you prepare. That's it in terms of board exams. If you have any questions on the board exams and specifically MRCP, I will leave MRCS for Abdullah to discuss. But if you have any questions about MRCP, let me know. Okay, so choosing PLAB or MRCP depends on what. If I have a year experience, can I choose PLAB? Again, choosing this is really depending on personal circumstances, like which one do you go for? The only thing I would point out is the eligibility. So PLAB you can do no matter how many years of experience you have. MRCP, you need to have at least 12 months of experience to be eligible to apply for it. If you don't have 12 months experience, you're not eligible to apply. So you cannot do it, for example, when you're starting internship, that's impossible. You need to have 12 months of experience to apply for it. PLAB, you are actually, a lot of you now are preparing for it before graduating. So that's a different story. But MRCP, you need to have 12 months experience. Now, from an individual perspective, if you have a year, couple of years, whatever you're more comfortable preparing for. As I told you, MRCP is a board exam. It's difficult, it's not easy. You need to have a bit of experience, go through the clinical guidelines in detail, have proper timing to study for it. So it highly depends. If you just want to finish the exams probably in a shorter time and start, go for PLAB. Otherwise, if you start studying for MRCP and you feel like you want to continue in that route, you can also do that, but just remember, MRCP requires 1 year experience prior to applying for it. After that, you can apply, but as I told you, be sure to know what you're getting into when you're preparing these exams. PLAB is an entry exam, MRCP is a board exam. So the level of difficulty and how to prepare for is highly variable, but these are pathways so that the people who have already had, for example, 2-3 years of internal medicine, they can pass this exam and just go directly into specialty training in the UK. That's the alternative option I'm talking about, because that makes you on the specialty registrar, not on the, you know, full registration. It puts you on the high specialty if you do it, and then you obviously choose whether you want to start the internal medicine training again or you want to go for specialty training. I will discuss this in a bit of detail once we get there, whether it's a good idea to actually jump in directly into training when you come to UK or not. Is our internship considered a 1-year post-grad clinical experience? Yes, it is. Does 12 months of internship count as, yeah, so yes, it does. So after you finish the internship, you will be eligible to apply for MRCP. But as I told you, PLAB is not the same as MRCP. Please be very aware of that when you're preparing for it. It's a much harder exam. It requires more time and more resources from you than PLAB would. PLAB is the easier way to get in the system, but MRCP equally makes you a very competitive applicant when you start applying for jobs after. And as I told you, you can do PLABs and then do MRCP part 1 at least, prior to applying. And you can study for these simultaneously. That can actually also maximize your chances when you apply for jobs. When they see that you have MRCP at least part 1 or MRCS part 1. Do we have to do the 3 parts of MRCP to get GMC registration? Yes, you have to. You can't just have one apply. You have to have all the 3 because that means you are board certified, because so whenever you see people having written MRCP next to their title, it's basically they've finished all of this. You don't get that title or that prize, which is, a member of the Royal College, until you finish all 3. And for that, for you to be able to apply to GMC registration, you need to have finished all of these 3. But as I told you, you can do PLAB 1 and PLAB 2, do MRCP part 1 to actually ease your way in, because that makes you a competitive applicant, whether it was for training or non-training jobs. Any further questions? Okay, we'll move along. And again, if you have any questions, we'll have time to discuss later on when I'm done. So if you have any further questions, we can answer them then as well. Okay. Now, applying for jobs. Now we've got all these things sorted. We've got the registration. How do I apply for jobs? How do I maximize my chances to get into a job? So I think my colleague Abdullah Ghazal has went through with you the different titles for different training levels in the UK. And it's important to be aware of these titles when you're applying for jobs, because when you're searching for these jobs, you need to put these titles. I'm just going to open one website. So there are 2 websites, NHS Jobs and AppTrack. And basically, both of them would have non-training jobs that you can apply to. And they always keep updating them. So wherever there is any new jobs, they will add them on. AppTrack usually is much more comprehensive, because actually when you apply for the NHS jobs, your application actually goes directly through the AppTrack and gets stored there, and then everything starts from there. So obviously you can look on both, but I think the main website would be AppTrack. Apply on both, but like your application on the NHS jobs will actually get imported directly to the AppTrack. So let's go through one of them now, just so you have a bit of an idea. Okay, so this is where you're going to apply for. Basically, as I told you, there are different names to the jobs. There is an FY2, there is SHO, there is Junior Clinical Fellow or GCF. If you are applying after 1 to 2 years of experience, then you should go for these titles. Otherwise, you can alternatively go for CT1, for example, which is what comes after the 2 years of internship. So I would say for any of you who have done 1 year, choose SHO, FY2, or JCF. If you have more than 1 year, you can also apply for a CT1. So let's give an example. So for example, obviously, if you're looking also for a specific job, some of them are rotational. And here we're basically just discussing non-training jobs, okay? The training jobs I'm going to go through later, but for non-training job, you can choose to be in a specific specialty, or there are jobs where you rotate between specialties. So it's up for you to decide whether this year you want to spend it in a specific one, so you get more experience, or you want to be rotating. So for example, let's say JCF medicine. So for example here, JCF, which is an SHO level in emergency medicine, they give you a detail. So if we go through it here, they will give you what is the contract term. So sometimes it's 6 months, sometimes it's 12 months, sometimes it's actually, you can actually discuss whether you can also extend if you like it. And they give you what the salary are and the closing date here. And then when you go down, you will be able to see what the criteria is. So there's essential criteria, there is desirable criteria. If you have it, like for example here, if you can see, the essential obviously is having an MBBS, full registration, evidence of achievement of competencies. So some of these will actually require you to have signed up the CREST form, which I will discuss with you. Not all of them do. Desirable criteria, and that's when you more likely, if you have these, then you'll get in, is first class honors for bachelor's, distinction through undergrad medical program, or having done MRCP part 1. And then they go into the details of what other essential criteria they're looking for, what are the desirable criteria. So generally speaking, if you have desirable criteria, you are a more competitive applicant, you're more likely to get in. Having said that, if you don't have them, that doesn't mean that you're not going to get in, but I'm just talking about how to maximize your chances. You can get in either ways, but these increase the chances of you getting accepted in almost every job you apply to. So this is an example. I'm just going to give you an example, another example before we go back. So let's see, SHO. So you'll have a lot of SHO jobs, as you can see, and they're in pediatrics, general surgery, orthopedics, emergency medicine, all the kind of, you know, specialties you might be looking for. Again, some of them would say medicine rotation. So you will be doing, for example, respiratory, gastro, and geriatrics, for example. That will give you a good experience when it comes to medicine, because I'm going to discuss that in detail now. But just as you can see here, basically, if you get a medical job, so there are two sides of this. If you do a medical job, which includes, like, you know, acute medicine or medical specialties, or emergency medicine for that matter, I think it would prepare you very well for the system. When you do get into training, you have a very good background. If you haven't done these jobs, you might be a bit overwhelmed when you start the training, because generally speaking, emergency medicine and medical specialties here, you need, if you're not aware of the system, you might, you know, slightly struggle at the beginning, because there are many things that are very different from the systems we're aware of. So you need to know them very well. Otherwise, it's just going to be a bit difficult for you in the first 2 months, I would say. If you don't do medical jobs, if I'm saying strictly to medicine, if you're not doing medical jobs or emergency medicine, it will not be as easy for you when you start the training to just flow in. You might just struggle slightly just to get to how the rhythm of the work is, what's the pattern, what do you need to do, because the pattern of how the medicine works is very different than how, for example, you know, if you're going for a specialty, like let's say neurology, rehab, cardiology, it's very different when you do these subspecialties than when you do a general medicine job. The general medicine job is usually very fast-paced, and you need to, you know, be very proactive when you start it, and you'll get through it easily. I'm just saying that if you're going into training, I would recommend that you do a medical job first, because that can introduce you to the system generally very well, so that when you start the training, you're not really overwhelmed. So basically, the non-training is a pathway that a lot of people will choose. And that is because it's easier to get into, and you can actually sign off your competencies while you're doing these jobs so that you can apply to the medical training. It's not really difficult. I'm going to go through how you actually get into a training job as an FY2 level. It's not difficult. It's just there are bits and pieces that you need to have had in order for you to do it. But most of the people would go for a non-training job, start off, get what they need to be signed off done, and then apply to the training. So, and for you to be eligible to start the training, you need to have had another 12 months after your internship in order for you to be eligible to start the training. So once you apply, they want to make sure that you have already started, let's say the applications, they open between October to December. So you need to have started at least in August, so that you have finished, or September maximum, in order for you to have finished 12 months before you start the training. So that's also something important to keep in mind. When you do the non-training job, there are things that you need to consider, again, to make you a competitive applicant when you apply for a training job, which I'm going to get through now. But since this popped up, I just thought I'd let you know about it, because I think some of you will be interested in becoming more academic. This is not a pathway that a lot of people would pursue, I would think, but some people would want to have a mix of clinical experience and academic experience. So with jobs like teaching fellow or academic fellow, usually you have split time between doing some clinical work and then doing a lot of courses and a lot of teaching and research for the undergrads and the postgrads. So that will put you at a position where you're actually actively involved in academia, and you will have a bit of a taste also with the clinical. This is a pathway you would want to pursue if you want to have an academic career, which again, I will discuss with you for those of you who are actually interested in academia, or having at least 50% of their time later on as a specialist or as a consultant to be involved in academia. But these are jobs that you can actually start with if you want to get into that pathway. It will give you a very good experience and background. So while you're doing, now that you have applied to these jobs, it's important to actually concentrate on these things. Personal statement, and I cannot emphasize how important your personal statement is, because this is what they're going to look at. So you need to make it precise. You need to make it not too long. Don't really put in anything more than 400 to 600 words. Try to get a pattern of how you need to present yourself. So you need to be precise. You need to mention all your strength points. And then you need to go through why this specialty and why this hospital in specific. So it needs to be in a paragraph pattern. It needs to start with everything that you have done that makes you competitive. So you've done this, you've done that. Research, for example, you've worked with groups for teaching project or for research project or any kind of project that you have done. Put all these strength points at the beginning and show that you've been very active and you have this 1, 2, 3, 4. Then you start telling why do you want this specialty. You can say, personal reasons as well as professional reasons. And then you can go through why this hospital in specific. Why, so for example, some of you would choose specific hospitals, let me say, King's College Hospital is very well known for its trauma center. So if you're going for emergency or surgery or trauma, you would say, for example, I'm going this because it's one of the most nationally known hospitals for this, and their values matches with what I'm looking for when I work in an environment, and so on and so forth. So this is just an example. When you're applying for a job, you need to mention, you need to show that you have read about this job, you've read about the values of this trust, you've read about this hospital, you know what they're strong for. And if you are aware of who's the panel that will be, actually doing the interview with you, it will also be good to have a bit of a background about what they do. So this actually really helps you. The personal statement, if you do it in that pattern and don't increase it more than 500 words, or 600 words at most, you will honestly immediately get calls for interviews. But a lot of people, I know that that's what you might have been hearing. A lot of people might have not gotten interviews. There is a bit of COVID situation that's involved in this, but I would say a lot of people don't pay attention of how to write their personal statement in a way that shows off their strengths, shows that they've read about the hospital, and shows the passion that they have for the specialty. So you need to do it in that pattern. And I can actually share with you a personal statement so you know how it's written. But this is a very important part to maximize. Honestly, if you know how to write it well, trust me, almost every job you're going to apply for, you're going to get an interview. So this is a very important part. Another thing that will help you be a competitive applicant is having done the ALS. And this is the link that you can go in to see what are the available dates where you can book it. I'm not entirely sure, to be honest, whether it's actually present in Saudi Arabia or they do the courses there. But if it is there, then by all means, try to do it there as well. Otherwise, when you come, for example, for PLAB 2 or PLAB 1, when you do the exam, just do the ALS course after. Because a lot of the jobs that when I started off, when I was seeing the person specification, they mentioned ALS. So if you have ALS, it also maximizes your chances of getting interviews and getting accepted. The third thing to look at, as I showed you now, when you're looking for a job, you saw there's essential criteria, and then there is desirable criteria. So if you have all the essential criteria, is great. If you have some of the desirable criteria, that's even better. So try to make sure whenever you also do the personal statement to see what are they looking for in the applicant. So the person specification document usually outlines that very well. So you can have like a template personal statement, and then when you're applying for different jobs, you can actually mention, the traits that are desirable so that you can stand out. Because if they see that you have the desirable criteria, you're highly likely that you'll get the job. So that's in terms of what can you do to maximize your chances, where to look for the jobs, and how to prepare for the application process for a non-training job. As I told you, the training job I'm going to discuss a bit later, but this is the pathway that most of you would do. And I would recommend that you do have this experience before going into training. FY2 standalone, which is a training pathway, can also be used, but it's a bit more difficult to get into, and I'll explain why later. So this is a pathway that most people would go for. If you have any questions on the job and how to apply for it, please let me know before I move to the next topic, which is how to prepare for the interview and what is expected. Okay, so do we need personal statements for non-training jobs? Yes, of course. So that's mainly the non-training job. The training job has a different pathway. It's the application itself, you need to write about yourself, but it's not a personal statement. I don't think there was a section where you need to write about yourself. It's just questions that you need to answer when you apply for the training. But this is all for non-training, what I'm discussing right now. Does the ALS expire? So yes, it expires in 4 years. So from the time you have done it. Why would I go for a non-training job? Again, this is something that I think it has been misunderstood. When I say non-training, it's not prolonging your time. It's not affecting you in any different way. But for you to jump in, I will discuss that now, but for you to jump in directly into training, not having any prior experience in the system, I don't want you, the reason that we are all telling you the same thing, that you need to, have an on-training job first, is that it eases your way in. If you just directly go into training, you will struggle at the beginning, and you would really, really struggle at the beginning, just because, not because you are not a good candidate or you haven't prepared well or you don't have enough knowledge. No, it's just that you don't know the system very well. So if you start training and there's a lot of expectations of you when you do the training and a lot of prerequisites, which I will discuss with you in detail in the next talk, if you do not know the system very well, you will really, really be overwhelmed in the first 2 months, and if not more, at least 2 to 3 months, for you to actually get your head around the system, make sure that you're doing everything correctly, not getting into any trouble just because you're not familiar with the system. So having a training job 1 year before you get into the training is very good. And obviously, anyways, they need you to have 2 years of experience before you apply to the training. So if you've already done only internship, you can't just directly jump in and apply for training. They need you to have done at least 24 months. So 2 years before you apply for training. But you can obviously, the CREST form, you can actually sign it off from working outside UK and inside UK. But the experience itself, you need to have it. Otherwise, they won't get you into training. They need to see that you had 24 months. So you might as well go for an on-training job. The training job for FY2, I will explain why it's a bit more difficult to get into, and it's very time constricted, very, very time constricted. And I'll explain why in the next slide. That's why we're saying usually it's better to get into an on-training. So exactly what Dr. Shulmer has said, you need to know the system. You need to be smart in how you're approaching all of this. I'm not saying this to be negative, but I don't want you guys to struggle when you get into the system. Even if you're a very good doctor, a very safe doctor, you know your stuff, if you do not know the system, you will be very overwhelmed. The system is really different from what we work with. So you need to be, and it's similar for US as well. Any system that's not familiar to you, you will be struggling a bit, but for UK, you need to play it smart. You need to be knowing the system in order for you to ace your training, not struggle at the beginning, because training on its own, it has a lot of prerequisites. Can I sign the CREST form in the internship? Yes, you definitely can. I'm going to go through what exactly is the CREST form, what do you need to sign off, but you can sign this in the internship if you've done all of these things, but you need, as I told you, to apply for training, have a bit more experience, because that's something they look at. You need to have 24 months. If there are no further questions, I'm gonna move on to the next slide. I'm gonna explain the training pathway for an FY2. And you'll understand why I'm telling you it's a bit more difficult to get into FY2 training. How to prepare for interviews. Generally, I would recommend for you to buy this book, because it's very good for you to prepare for interviews, for non-training jobs, for training jobs. And it really covers a lot of the topics that you would be asked about. But generally speaking, for interviews, you'll have, most of them will actually involve a clinical scenario, an ethical scenario, and then portfolio questions. So basically, a clinical scenario, depending on which subspecialty or specialty you're going for, they're going to concentrate on the emergencies of these specialties. Like for cardio, cardiac arrests, arrhythmias, heart failure, decompensated heart failure, things like that. So you need to be aware whenever you're going into a specialty, what are the emergencies of these specialties? Because most of the time they ask you about the emergencies. They can have a small scenario about something that's ongoing or chronic, but usually they ask about the emergencies because that's what they worry about. They need to make sure that you're competent to handle emergencies. They will also ask you an ethical scenario where you, for example, I'm just going to give an example, like discussing the resuscitation status of a patient. And if you were put in that situation where you need to discuss it, what will you do? And so on and so forth. This is just an example of ethical scenario, but obviously it varies with the specialty and what are they expecting out of you. But they need to be, they need to make sure that you know the ethical basis and you know how to go around these things and how to manage them, because you will be put in these situations. You will have family meetings, you will have times, especially with the resus statuses, where you need to discuss with the family and you need to make it very clear. These are the most ethical things that could come, but again, this is something that they will have a station for. And then they will discuss your portfolio. So what have you done so far? What are you planning to do? What is your expectation of this post that you're going for? They will discuss your CV basically and see what your expectations are, and then they'll give you time for questions to ask about the post itself, about the hospital, and what you want to do. Like, for example, if you want to be involved in research or committees in the hospital, you can ask also these questions during the interview. And usually they will let you know within a couple of days to a week maximum if you've got in or not. It varies obviously with different hospitals. Sometimes they're delayed, but usually you'll know within a short period whether you've got the job or not. So that's it for the preparation of the interview. If you have no further questions about the interviews per se, I can proceed forward on after that, what comes when you apply for jobs. I'll give it 1 minute in case you guys have any question. All right, if there are no further questions, then we can proceed forward. From the offer point forward, once they offer you the job, something I need to point out, because that's something that people sometimes had issues with. When you get an offer, if you're not planning to accept it or you're waiting for another offer, do not tell them that you have accepted. And then when you have another offer that you wanted more, you tell them, oh, sorry, I'm accepting another offer, because that under the GMC, this is not ethical and you can be reported. So once you actually give your word to a hospital, do not back down at the last minute because you have another offer. If you are waiting for another offer, you can ask them to give you time to respond to the offer. And then once you get both offers, you can choose from them, but do not accept one and then back down to go to the other one. This is something that you can actually get in trouble for. So this is something important to point out, because some people, out of not knowing the system, they actually did that, and then some issues started happening. So if you know this, you know how to act around it. Just tell them, I need more time to respond to your offer, and they'll give you a specific time where you can respond. After which, once you respond to the offer and you get in, there will be issuing you a COS, which is a certificate of sponsorship. And that's what you can use actually when you apply for the visa. So you need to have this in order for you to apply to the visa. And the visa is usually for doctors. There's a specific visa for doctors now, which is skilled worker visa under the healthcare visa. So the nurses and the doctors and the healthcare assistants go directly into this kind of visa, and that's the one you need to be applying for. And after you apply to the visa, just FYI as well, once you get a job, it's really highly unlikely that you'll actually get rejected for a visa, because especially for doctors, they're in need of doctors. So the likelihood of you getting rejected is minimal once you get a visa, once you get a job in there. It's a bit different, obviously, when you apply for exams, but now it's not been an issue anymore. It's honestly just know what exactly they're looking for and the do's and don'ts when you apply for visa. If you have questions about that, I'll share my contact details. You can, message me about this, but it's not really very difficult to get a UK visa, even if it's for the exam, but you need to just play it right. You need to know what they're expecting and provide everything, because once you provide everything, it's very highly unlikely that they'll reject you. Now, proceeding forward from the visa, once you apply to the visa, you wait until you get the response for that. And from that point forward, you get a residency permit. So once you arrive to the UK, if you're not in the UK, you get a residency permit that you need to collect. And they will do what we call eligibility checks. So they need to make sure from an occupational health perspective, you're clear. They might ask you to do some blood tests, immunization records, and so on. And then there's a DBS check, which is basically just to check your records, that there isn't any criminal records. For some countries, and not all countries, you have to do a police registration once you arrive. They will let you know once you get the response for your visa whether you actually need to register with the police. It's in some countries, Arab countries, but not all Arab countries, and some of the countries, in different parts of the world. The details of which you'll actually find on the gov.uk website, but they will let you know once you get the response for the visa whether you need to apply for that. And I'm just telling you this because it's important not to miss it, or, it's usually within 7 to 10 days of arriving, you need to apply for that. So you just need to be aware of that when you come here so that you do everything on time. So that's from the offers perspective. The next point will be the training part. What would be, why would you go for non-training and non-training? If it's training, what would you need, and what's the time constrictions? So before I start with that, if you have any questions, please let me know. The skilled worker visa is the same as the tier 2 visa. So the tier 2 visa is an umbrella term. There are around, I think, 4 types of visas under that. So it's a tier 2, but you need to apply for a skilled worker when you apply for the visa, because you'll find that there are many options. So that's why it's a skilled worker visa when you start working. And what about the UK MLE? I'm assuming you mean UK MLE. UK MLE is just an alternative way to name the PLAB. It hasn't been done yet. It will be done, I think, by 2024. They will change the name of the PLABs to the UK MLE, and they might change the details of the exam slightly. To be honest, they haven't really discussed in detail what will change. So is it just the naming, or that the pattern of the exam will change? But I don't think there will be a huge difference. There might be a bit of difference in the conduction of the exam or the levels of the questions that you might have, but I don't think it's something really major. The preparation will more or less be the same. Any more questions? Okay, so do you guys want me to discuss the PLAB 2 visa? It's just, they are aware that people that are coming to do the PLAB exam. So if you put in the visa that you're coming to do the PLAB exam and you're coming for this period of time and coming back, you should be fine. A mistake that a lot of people do when they apply for PLAB 2 visa is actually say, I'm going to a Swami course or a Samsung course. Do not mention that, because these are not registered courses. So when you say course, if they're not registered courses, it actually is a negative part on the application. So when you apply for a PLAB 2 visa, do not mention that you're going for any course. Just say, I'm going to the exam, which will happen on this. I will arrive, for example, 1 week to 10 days so that I can familiarize myself with the area, and I will stay for this amount of time. So if you do that, I don't think getting a visa would be an issue. I think a lot of people had visas rejected because they mentioned the course. Do not mention the course. As I told you, it's just because it's not a registered course. So if it's not a registered course, they don't know what that is. So they don't mention it because that might affect your application. But to be honest, I think, again, that's a concept that people are hearing, that it's very difficult to get a visa for the UK. It's not, but honestly, it's just about playing it right, knowing what to mention and what not to mention, making sure that you're providing everything they require, because the more evidence they have, the less likely that they'll reject you. But if you don't give them enough evidence, they wouldn't be able to assess your application properly. To be honest, no, I think if you say PLAB, so let me tell you something. If you apply on the basis of tourism, I'll put it this way. If you've already traveled to Europe or US before, that's one. That actually is a plus point, by the way, because they look at that. If you've traveled a lot previously, especially to European and American countries, it's highly likely that you will get accepted. And I think all of you are aware of why that is. Another point is if you're working. So if you have that, you're working, they know that you're coming back. You're not, planning to stay there. Although I understand that we're saying if we're doing a tourist visa, they need to make sure that you're coming back. So if you don't have any connection, so you're not working, you don't have any contract here, they will also have a bit of a problem with that. So if you're planning to do it as a tourist visa, you need to have all these things checked. Otherwise, actually saying that you're coming for PLABs is a lot better, but make sure that you're not mentioning the course. Just say, I'm coming to do PLAB and I'm coming back. That's it. Again, that maximizes your chances. And I'm just telling you from experience, from my personal experience, and from people's experience, it's just few bits and pieces. If you know about it when you apply to the visa, honestly, it's not really a hard thing to get the visa. And I already have a UK visit visa. Can I just use it for PLAB 2? Of course. Once you already have it, then you can do whatever you want with it. But if you're applying, then I think mention PLABs. Otherwise, you need to have a job so they know that you have something that connects you to come back. How many months of visa should I apply for PLAB 2 to attend the course and prepare and finally write the exam? Usually the minimum is anyways 6 months visa. You can't apply for less. So it will be 6 months, multiple entries. If you apply for more than that, because there's 6 months, 2 years, 5 years, 10 years. If you apply for 2 years from the beginning, it will be, I don't think it will be accepted. For you to apply for 2 years, you need to have gone once or twice. So that they have a good record. Don't apply directly for a 2-year visa, and you don't need it when you do PLAB. So it will make them also raise questions that why do you need 2 years visa for just a PLAB? For PLAB 2 to attend the course, again, do not mention the course. I repeat that and I underline it 100 times. Do not mention the course when you're going for the visa. Just say, I'm going for a PLAB 2 exam. Okay, please, I'm repeating this because it's very important. A lot of people's visas got rejected simply because of that. You can only apply to the visa like 3 months prior to your flying date. So you can apply within that time, time limit. But the minimum is 6 months. And you can, as I told you, go on a tourist visa, but make sure if that's the case, then you have a job that they can know that you're coming back to a job. You have a connection to come back to, basically. And honestly, if you do all of these things, the likelihood of you getting a rejected visa is minimal. Again, for these perspectives, because I know some people are hearing, different things, please come to me. You can, email me or message me, and I will let you know what you need to do and what you need to do. I've generally talked about what you need to mention in the application for the visa, but in terms of documentation afterwards, I will tell you what you need to put, because obviously it's different in different circumstances, but there are main things that you need to put. Once you put all these documents as an evidence, you'll be good to go, including the PLAB exam date, accommodation. Make sure that the everything that has any words in Arabic is translated to English. If you are taking your dad's bank statement, then make sure that you also give them a letter that identifies, or a letter of employment of your dad, and make sure that also you supply an evidence of how is he connected to you. So a birth certificate that's translated, for example, sometimes a passport that shows that, you know, because our passports usually say that the name of the father, so they can also match that. So these things are very important. I'm mentioning these documents because they're mandatory, and that minimizes your chances of getting rejected if you supply all of this. Okay, I'm going to move forward now to the training. The standalone FY2 is a training, FY2 rather than non-training. The reason I say it's a bit more difficult is what we're gonna say now, which is you need to have a minimum score of 7.5 in each domain in IELTS. It's, as I told you, I think if you prepare well for the writing from the Baron's Handbook, you should be able to get it. But I'm telling you, just from what people have been telling me, a lot of people can get to a 7, but 7.5 in writing was a bit more difficult to get through. I think it really highly depends on who's correcting and how you're preparing. The more prepared you are, the more likely you'll get it, but it's not easy to get a 7.5 in writing. The other thing is that you have an OET with a minimum score of 400 in comparison to 350, as you remember. So that's one thing that people probably get stuck in, and that's why they cannot apply for that training FY2. Otherwise, alternatively, you should have a 3 months paid employment as a doctor in the NHS, which is a bit difficult if you've not, because if you're applying from, you know, outside UK, you wouldn't have this. So this is an alternative thing if you don't have these scores. So some people can come, for example, do a 6-month or a 3-month job in UK, non-training, and then they apply for that. The time constraint is that this application opens in, I think it was September to November, and you actually have to wait for a year because you need to do an exam, you need to be shortlisted. I think the exam was MRSA, which is just an entrance exam, and it's not specific to medical knowledge, as far as I'm aware of. I don't know the details for that. So, but I can check and discuss it with you in the second talk later. But for you to get shortlisted, get an interview, get your training number, this takes an entire year. So just when you apply for the US matching, it takes an entire year. So if you don't want to wait all this to get into the system and you want to just start off, then go into a non-training. That's a lot of people. So the thing is, a lot of people don't want that. A lot of people don't want to, you know, wait that long until they get in, because that means a year. Some of you might want to do TA, want to do something else, but some people want to start right away as a clinical. In that case, you need to be aware that you have 1 year from the time you apply until you start. And you need to be aware about that. You need to have this. There are other also things that you need to be aware of. So so basically this, and you've seen the link on the slide, you can go through it in detail, but this shows what are they expecting for you to be actually shortlisted for a training post as an F2. So most of which, you need to have MBBS, you need to be a doctor in training by this when you start the F2, so you should have done 1 year at least. You can go through this in details, but I think most of the people get stuck in this because you need to have the IELTS of a specific score. So if you're able to actually, fulfill these criteria and you don't mind waiting for 1 year until you get through them, by all means, go for that. It's just, as I tell you, some people want to start right away, and that's a much easier pathway to go through than non-training pathway. obviously, benefits of getting into a training job is that you know the system very well, and you know what a portfolio is, what you need to be expecting when you actually get into internal medicine training. So it does give you a benefit, and you're much more supported in a training job rather than a non-training job, because you have an educational supervisor and a clinical supervisor, which makes sure that you're right on course, you're signing everything off, you're doing everything that needs to be done. So it is very beneficial to start at an FY2. But as I told you, these are the constraints or the limits, I would say, to whether you want to go for it or not. But obviously, depending on your, personal circumstances and your English language test scores, if you feel that this is a better way for you to get into the system, it's actually very beneficial. But as I told you, it really depends on what's happening in terms of the English test and what are you wanting to do. Do you want to start right away? Are you okay with waiting a year? It highly depends on these things. So up until now, do you guys have any questions about this specifically? Of course. Are you held fully responsible for patient care in a non-training job? Of course. You're going to be a doctor. That's the thing. Both of them, you're going to be fully responsible. It's not like an observership or you're not having a lot of responsibility. You are fully responsible, just like a training person. It's just the training pathway has more prerequisites. You need to have finished multiple things, and there are criteria that you need to fulfill by the end of the training year. So you need to have signed things off. You need to have, attended conferences or courses, minimum time of teaching, CPD hours. You need to have done all of these things by the end of the training year. While on a non-training job, this is not the expectation. If you can do all of these things, then great, but you're not having any set criteria that you need to fulfill when you finish this job. This is something that you dictate for yourself. However, if you're doing a training job, no, there is a set of guidelines that you need and prerequisites that you need to finish by the end of the training year. And that's the difference. But in terms of what you are responsible for or what are you doing, it's exactly the same in terms of job. It's just what you need to sign off. That's different. Will there be an attending consultant I can refer to if I need it? Of course. So look, what's good about this system in UK is that you always have an F1, an F2, and then a core training, whether it was surgical or medical, or people at a core training year 1 or year 2 level. And then you have a registrar or a specialist and a consultant. Usually you have all these people around you most of the time, except for the consultant at all times. So you can contact them very easily. You're not expected at a level of FY1 or FY2 to be fully responsible for a patient, and they would look down if you start asking questions. Not at all. That's what's really nice about here, is that they want you to know your limits. If you do not know what to do, do not put the patient at risk just because you did not ask. If you don't know something, it's completely fine. It's not something that's looked down at, no matter what your training level is, as long as you ask about it. And there's always support from that, whether it's a training or non-training job. The registrar is always there so that you can ask them questions. If you're not sure about a treating specific thing or a step that you need to do for the patient, by all means, directly go and ask them. Don't say, oh, it's a small question or it's a stupid question. Nothing is stupid. If you put the patient at risk, then all of you will be at risk. Be sure that you always seek support. This is very supported here. They do not think less of you just because you ask simple questions, because they know you're also coming from a different, country with different guidelines. It's completely okay to keep asking. That's what they want you to do, actually. When you become a registrar, the responsibilities are much higher, the expectations are much higher. But when you're starting off as an FY2, even in the core training, the expectation is not really significantly high. But when you become a reg and you're in training, then you are expected to hold responsibility for a large number of patients, and people will be coming to ask you. So at that level, you should be confident in what you're doing. Does the English requirement apply to specialty training as well? No. So basically, the English requirement is only when you start applying for registration and getting the first job. After that, you're good to go. You don't have to go through this hassle again. So only when you apply for registration and only when you apply for the first job. If it's a training job, they need that. Otherwise, the other jobs, as long as you got the registration, that means your English is good. So they don't need anything furthermore from you, basically. Okay, so 12 months of non-training will count as an FY2, and then I can directly apply for core training. Okay, so basically, let's just say you finished your internship in July, okay, or June. After that, if you have finished, it will be good if you guys can actually finish the exams, get the registration, so that you can actually start, let's say, applying for jobs. And if you start working in, like, let's say September, you can actually get this 3 months before you apply for the training, because training is usually open from late October to December. So if you start in September, because you can get jobs, by the way, when you start, if you have everything, in 1 to 2 months, you can actually get a job. So just make sure that you have this time frame in mind. If you have finished all your exams, you got your registration, it's only a matter of time, to be honest. And applying for GMC also is pretty straightforward until and unless you have done electives outside Saudi, because they need to make sure that you've actually had a registration. And if you didn't, why that is. If you guys want me to discuss that in further detail, that I can also include it either towards the end of this talk or in the next talk, but that's an important thing to be aware of. But basically, you need to have finished 12 months by the time you start training, not finish 12 months so you can apply to training. So if you start in September, sign the request form for things you weren't able to sign in internship, get all what they need done, apply from November to December, and then by the time you get to August next year and you got accepted in a training job, you would have finished the 12 months. So that's the pattern that you need to be thinking of. So yeah, I'm going to discuss with you as well what to do to maximize your chances to get into training as well, because while you're doing the non-training job, you can actually do a lot of things that will maximize your chances to get into a training job. And these are also things that you can start working on from now. And I would prefer that you don't overwhelm yourself in 1 year. Try to finish things that you can finish while you're still in Saudi or anywhere else. And then when you come there, you've already had a lot of things ticked off so that you can, straightforward apply for everything and know. So the reason, the main purpose of our UK series is just to prepare you well so that you know your time frame, you know what checklist you need to have finished, things to have been done, what you need to do to maximize your chances. If you know all of these things ahead, trust me, it's very easy to prepare yourself to get into one of the most competitive specialties. It's not that difficult, but you just need to know. You just need to prepare in advance. And I'm talking including things like surgery, specialist surgery, ophthalmology, ENT. These are things that I know, generally speaking, it's known to be quite difficult to get into, but trust me, it's all about how you work on your CV. If you know what you want, start working earlier, you'll get in. In UK, it's not that difficult to also get. It's difficult everywhere, but it's in UK, you just need to have ticked off specific things. If you have, trust me, you'll get in, even if it's a competitive specialty. If you are a competitive applicant, you will get in. It's not impossible. So what can we do during our undergrad to help increase our chances? I will discuss this now. But basically, that's the idea now. Up until now, what can you do in that FY2, whether it's training or non-training, after you get the registration? Now, how to prepare for the specialty application from this point forward. The request form is the most important thing. This is the first thing I'm just going to go through quickly. So this is what the request form looks like. Most important thing you need to do know that only consultants are eligible to sign this certificate. They have to work with you at least 3 months in the past 3.5 years. So these are the most important things that you need to know when you ask someone to sign you off. Basically, the other thing that I wanted to mention is that if you are in a medical job,
it's better to sign it off from there, because that's what they expect you to be. If you are in a medical job, then it should, most of it, be signed from there. It doesn't necessarily mean that everything needs to be signed from there, but that's the expectation. This form does tend to change almost on a yearly basis. They add, they delete things. So make sure whenever you sign it off in preparation to apply for the training, up to 1 month before the application, it can actually change. So just make sure, I think that happened once though, that one, like a month before the application opens, it was changed. But generally make sure that you are checking that there's no updated version that you need to sign off, okay? And basically this is how it looks. You need to put your name, your GMC number, what roles have you done, when was the start and the end date. And then basically there are things that are very straightforward: professional behavior and trust. This is really straightforward in everyday job. Mental capacity assessment. I think this more or less is done whenever you're doing any medical job, because in order for you to give any treatment, you need to be aware of how to do that. So these are usually done in internship. I don't think you'll have any issues with actually signing them off. So the other section would be the teamwork, the leadership, the communication. So you can see a lot of it involves communication and how you deal with complaints, how you deal with patients' records and confidentiality, and working within a team, and any leadership roles that can be as minimal as you're leading a ward round. They can ask you to lead a ward round once, and that alone can be a leadership. So basically, they just need to see that you're in an activity that shows that you have leadership potentials. And make sure that whoever is signing you off is signing on each paper, and towards the end as well. The section 3 is clinical care, and that's where sometimes it might be a bit difficult to sign off everything, but not impossible. So you need to have dealt with acute cases and manage them and assess them, and managing the long-term issues and conditions in the acutely unwell patients. And you've dealt with frail patients, elderly patients. You've dealt with nutrition and discussion with dietitians and prescriptions, and you know how to do history and physical examination appropriately, and you have an evidence of diagnosis and clinical management, mainly the immediate, and then the discharge planning, what you need to be aware of when you discharge. So these are things that are done when you do any medical job, or any, generally, not specifically to medicine. If you do any job, whether it was peds, surgery, medicine, you'll be able to sign off all of these things, but it depends on what was the level of involvement that you're in, which is really different according to which hospitals you guys are going for an internship. So as you can see, it's just how to manage every day-to-day, cases, basically. And the other thing is perform the procedure safely. And the procedures are things that you might not be doing a lot of them while you're doing internships. So that includes catheterization for males and females, IV cannulation, prescription of IV fluids, prescription of antibiotics, and doing intramuscular, intravenous, subcutaneous injections, doing blood transfusion and knowing what to look for when you're doing that. So these are things that, depending, and also ABGs. So it really depends. If you can actually, guys, try, because sometimes, again, it depends on the hospital and the level of the involvement. Try to be proactive and try to actually do these things and learn them, because it is expected from you when you start your job, especially at a junior level, that you are doing them without any, supervision or help. Having said that, if you don't know them, you can always ask for help, or if you don't have that much experience, but try to get your hand to be skilled in these things, even if it's not something that's, expected in detail from you when you finish FY1 or internship. Try to be proactive in doing these things, because it's good for you as a clinical practitioner. So these things, sometimes you can't always sign them in internship, and that's why you do it in FY2 when you do it in UK. The cardiac and respiratory arrest, again, you must have been involved in resuscitation and simple airway management and defibrillation. And this has changed in the recent years. So an ALS course is insufficient evidence to demonstrate capability. Before that, that would have been enough, but now they want you to have at least, went through cardiac arrest once or twice, and you were observed to be able to manage the basic things. You don't have to lead it, you don't have to do any of that, but when they say here and is able to lead when necessary, they just that you have the potential, you know what you're doing. So again, these things, try to be involved. If there is one, try to be involved. This is good for you as a doctor to have more experience in it, because it happens all the time. So the more experience you have in that, the better, and you can easily be signed off. As I said, the do not resuscitate, the discussion is very important, and end of life care, palliative, doesn't have to be a palliative rotation, just palliative care, you know who to refer to, and care after death, which is the mortem or confirming the death by appropriate physical examination. You need to be aware what you need to be doing and how to report it and record it for the medical certificate of the cause of death. So care after death is also something that try to be involved in when you're in FY1, so that you can also have more experience and get to sign it off. And lastly, quality improvement, just competence and safety when you deal with the patients. And you need to have been involved, most importantly, in a quality improvement project or an audit. Again, this is different in which hospital you're working in. Some of them are very active in that, some of them are not. If you do manage to get into an audit or a quality improvement while you are doing, you know, your clerkship years or you're doing your internship years, that would be very great, because you can sign that off easily. Obviously, just to mention that you can see here, they can sign you off as personally witnessed, so the doctor saw you doing all of this, or evidence received. So if one of the specialists or the registrars or the fellows actually saw you doing this, they can report to the whoever is signing you off that they have done that, and they can put, you can put their names down, the specialists' names down at the end of this crest form. And then this, highly unlikely that anyone will sign it off unless they don't know very well. And you can actually have more than one version of this if a doctor can sign you off on some things and not others. So if he didn't see you, he would say unable to confirm. Whatever he puts that on, you can sign it. Whatever people saw you doing in the unable to confirm from one doctor, you can sign it from another doctor, and then you can upload both of them. Or one doctor can put, you know, ticks either evidence received or personally witnessed, and then put the names of the people that he has received this crest form from, which all is here. So this is the person who's signing you off completely, and he can take the crest forms from other people or from the fellows that witnessed you. He signs here, and you put the name of the people who have witnessed you here and what capabilities they have witnessed. So this is the crest form. Again, important goals to achieve during this year before you apply to training is that you've done a quality improvement projects. Try to do this within the internship year as well. Again, if you want more details about this topic, I can discuss it with you in the next talk. Try to be involved in teaching. So they usually have like weekly teaching in any department that you can, you know, prepare a presentation and, you know, actually be actively involved in the teaching department in that department, because they do it on a weekly basis, and they will sometimes set people to discuss, but sometimes you can actually volunteer and discuss it as well. As I said, procedural skills, very important. Try to be involved in that from, you know, your internship here. Don't, it's very important, to be honest. And again, it depends on which hospital you're on and what kind of, you know, exposure you're getting, but try to be proactive and do what you can in terms of these procedural skills, because it can train you better. You can sign off your crest form and have 12 months of experience by the time you start training, as I mentioned, because that's why you just make sure that you get at least, if not 12 months, 11 months, because that will be the cutoff. So this is something that they make sure before you start training that you have finished, basically. The next part will be to discuss the academic part, the master's, because I think some of you had questions about that. So I'm just going to answer the questions that are on chat now before we proceed forward to that. Where do we check the most updated crest form? So as you can see, this link that I've put on, just always check it. Whenever you put crest form, it will, even on Google, it will appear right away. And they will tell you if there has been any updated versions when you get into the website. It's a specialty training website. So as you can see here, this is the specialty training HEE. If you go into there, they will put usually the most up-to-date one, and they will tell you if there has been any recent changes. They will put on the website. And it's usually just from here, and you get that request form just from that website. Are we expected to get request forms signed from our internship here in KSA? I'm almost done with internship and haven't worked with a single doctor for 3 months. So if you can, again, it's sometimes difficult, and I think if they've worked with you for at least a couple of months, this might do. That's why it's a bit more difficult to sign it off in Saudi, just because you don't work for 3 months in a row, but sometimes you can get it sorted if you've worked with at least for 2 months with them. But that's why I'm telling you, it's more easy to get it signed off in UK, because you will have this 3 months block in each rotation. So you'll definitely be able to sign it off. Can we do internship in the UK too? That's what I mentioned at the beginning of this talk. I will have to make sure of this. My understanding is that now it's possible, but for me to tell you the details of that, because I wasn't involved in this, I never did it, and I don't know anyone who has done it yet. So I need to double check with the GMC. And from that point forward, I can tell you in the next talk that we're going to have whether this is possible. But my understanding is that it is possible. You just need to have a letter from the uni that you have finished all the prerequisites, basically. But for a definite answer, you can, if you can give me until the next talk, I will make sure that to make this a bit clearer for you guys. Do you need evidence to show that you were teaching when it comes to applying to a training position, or evidence of anything extracurricular like certificates? Yes, definitely. Please try to always get anything you have worked on, whether it was, teaching, leadership, involvement in committees, anything you do, either have a letter of recognition for that, detailing what you have done, how long have you done it for, or a certificate that mentions these details. It's very important, because if you don't have these evidence, they will disregard what you have done. Even if you mention you have done it, if you don't have any evidence, it will not be put as you have done this, unless you have an evidence for it. So for you not to have to go back and see what you have done and get certificates for that, whenever you do something, just ask for a certificate for it, or a letter of recognition from the university, and they should be able to supply it to you, in a very straightforward manner. We've all have done this and asked for the certificates or the letter of recognition, and the university has been really, really helpful in providing us with that. So, but just, be up to date. Don't wait until the last minute to request these. Do you have any further questions before we move on to the next section? Okay. So now moving forward to the training pathway generally. As you can see, foundation training is 2 years, one of which we do it as an intern, and the next one would be as a training or non-training job, however you want to pursue it, but you need to have finished 2 years. And then you go into either internal medicine training or surgical training from that point forward. For internal medicine training, it's usually now 2 to 3 years. What is different in that? It depends on which specialties you actually want to go for. So there's group 1 specialties, and then there's group 2 specialty. Group 1 specialty, and I'll show you what specialties are these. You need to have finished 3 years of internal medicine. Group 2 specialties, you need to have finished 2 years of internal medicine before you proceed forward. Having said that, when you do these years, you have got to have finished MRCP by the 2nd year. When I say MRCP, as in all the 3 exams. So that's why if you can do it ahead, like do at least part 1 ahead, then you only have these 2 exams to finish in these couple of years. But it's expected generally that you finish part 1 in the 1st year, and then part 2 and PACES in the 2nd year. It doesn't mean that you won't proceed forward to the year after if you don't finish them. There are circumstances, and they completely understand that when they assess you on a yearly basis, but it's better for you to have finished them on the first 2 years. I will tell you more details about what's expected for you as an internal medicine trainee once we do the internal medicine talk, but this is just a general idea. And then you move on to the specialty training, which usually is 4 years. Sometimes it can go up to 5 years. And you have to have finished one exam, which is related to the specialty, basically. And then from that point forward, you get a specialist certification, you get a CCT, and then you become a consultant. Now, this is a new system. Usually it was 2 years of internal medicine, despite what group you're going into. But now it became 3 years, because you will be a dual specialist. So you'll be a consultant internal medicine specialist and a consultant, for example, if you go for cardiology, neurology, then you'll be a consultant internal medicine and consultant cardiologist or neurologist. So you'll have a double board, basically. I know that a lot of you, because that's a lot of the feedback that I've received, people tend to say, oh, this is a longer period of training. Why should we go for a longer period if we can finish it a bit sooner? And I think that's why a lot of you want to jump directly into training. The most important thing that I need to say is, at the end of the day, you should see it as you're working, you're progressing. It's basically you're just getting promoted every year. So if you look at it from that perspective, it's a lot better. And to me personally, the experience of having a very good internal medicine background, specifically when I'm talking about medicine, having a very good medicine background and then doing the specialty, honestly, it makes you a very, very, very good doctor, because you are aware of all the other specialties and you have a very detailed knowledge about your specialty. So that makes you a more comprehensive doctor. And at the end of the day, when you go anywhere after that, you can actually work as an internist or as a, as a specialist in a specific area, or both. And for you to have 2 boards is really, really good. And if we're looking at it in comparison to other countries, it's not really that different. Just because, in US or Germany, you need to have at least 3 years of internal medicine, and then you do 2 to 3 years of fellowship, and then you become a consultant. So here it's 7 to 8 years, there it's 6 years. It's not a major difference. It's just 1 to 2 years difference. And it gives you become a more comprehensive doctor when you do it that way. So it might be a bit longer, but not that much longer, and you become more comprehensive and you learn a lot more. And coming from a person who wants to do specialty training, for example, for me, I want to do neurology. I think having a very good basis in medicine is very, very helpful for me. I can see it now. All of us want to finish sooner, but when you have more comprehensive training, it really helps you become a better doctor in how you manage things. And you'll be able to manage all, medical subspecialties problem as well as your own specialty. It makes you a very comprehensive doctor. So I would say I wanted to put that out there just because some people might think this is a longer training, but you need to see it from different perspective. And the fact that you will be, dual accredited rather than one specialty, you'll be dual accredited. Now, almost the last part now that we're going to discuss is the academic pathway here. That's what's different from possibly all the other countries that you can apply for medicine for, is that they have an academic pathway. So you actually can either be 100% clinical, or you can actually go for, 50 to 75% clinical, and then the rest of the time is purely dedicated to academia, including research and teaching. So if, some of you, I think, would be interested in going for an academic pathway because they enjoy doing it a lot more, but they want to still have a bit of clinical exposure, that would be a perfect, pathway for you. Just before I go through with that, I'm just going to answer the questions. I am surgical ophthalmology is another pathway alone, or you're not aware. So surgical, general surgery. So if we talk about general surgery and then, plastic surgery, pediatric surgery, and all these subspecialties, including ENT, these will all fall under core surgical training. So you need to do 2 years of core surgical training before you move on to all these specialties. My colleague Abdullah will discuss the surgical, training and the subspecialty training in surgery in more detail, but more or less the pathway is similar. It's just what is expected from you when you apply can be a bit different in different specialties, but they all have the same main prerequisites that you need to have fulfilled. It's a bit more different with different specialties, so that's why we're going to cover the most wanted specialties, which is either medicine and medical subspecialties or surgery. I'm covering IM in the next talk. Abdullah will be covering the surgery in his talk. In terms of ophthalmology, so basically you have subspecialties, which is a run-through. When I say run-through, is that once you get accepted into the training, you're there until you become a consultant. However, when you apply, just like when you apply for internal medicine in US, when you have this training and then fellowship, you need to reapply. Same goes here. When you do internal medicine, you apply for a region and you get to stay there for 3 years, and then you have to reapply. You probably would get into the same region, but not necessarily. However, when you apply to specialties, which are run through, and I'm gonna put them down now, ophthalmology, neurosurgery, OB/GYN. These are the ones that I'm aware of that are actually run through. If you also want a bit more detail about how to get into these, I can have a quick overview in the next talk when I discuss IM. Some of the surgical specialties, if Abdullah also has time to actually cover these, we can actually cover some of these specialties, so you are aware, not just about IM and surgery, but other specialties. So if some of you are interested in OB/GYN, ophthalmology, we can also discuss them. So me and Abdullah can arrange to actually, discuss it with them and how to approach them in more detail. But just for you to be aware, these specialties, when we say run through, it's 8 years straightforward. So you finish FY2, and then it's 6 to 8 years, depending on which specialty it is. And once you get into the training of this specialty, you just stay in the same region, between like 2 to 3 hospitals, I guess, and they will tell you which hospitals in that region that you'll be in, and then you'll be having this visa for this training job until you become a consultant. So you don't have to worry anymore. It's a run through. You do all these exams, you go through all these years, and you'll be good to go. So they're ophthalmology, neurosurgery, and OB/GYN. And as I told you, we'll discuss the IM and the surgery in the subsequent talks, but this is a general idea. So to get into core specialty training, we don't need a training job at all. We can do 1 year of internship in Saudi and a year of a non-training, right? Core, not specialty. So you need to have had 1 internship here and then 1 year of training or non-training job. You get into core training. You do core training for 2 years or 3 years, and then you apply for specialty training. You cannot jump directly into specialty. That's not possible. Unless, and that's honestly, I've seen people struggling to get it signed off. If you've done, for example, internal medicine or surgery for 2 to 3 years in another region outside UK, you need to have evidence that you have done all the prerequisites that's required by a UK doctor in training in these specialties to be signed off, and then you can apply to specialty training directly. And you need to be signed off by a UK doctor. That means that you have to come and do at least 6 months to 1 year, and it's not really easy for them to sign you off on all these prerequisites that you should be doing in 3 years in core training. So to jump in directly to specialty training, if you have experience, might be a bit difficult. Not impossible, but difficult, because you need to have evidence that you have done everything that you needed to do during your internal medicine job or your surgery job that you have done for 2 years outside UK. Radiology, we can give an individual basis and try to get, okay, are clinical attachments considered as experience? I'm going to come back to the previous question. Clinical attachments considered as experience? No, especially at the term clinical attachments in UK is considered as an observership. It's not considered as a hands-on. You need to understand when you apply for clinical attachments in UK, whether they are considered as hands-on or not. You need to ask them, but usually it's not. It's good to have it because that means you know the NHS system, but they're not considered as experience per se, maybe an NHS experience, but not a clinical experience. So what I suggest, because you guys have questions about different specialties, me and Abdullah and Vikram are covering the 3 main specialties: IM, surgery, and psych. If you want alternatively to discuss ophthalmology, so I think the surgical subspecialties, they all fall under core surgical except for neurosurgery and ophthalmology. And then you have the OB/GYN and the pediatrics. And you also have the radiology. If you guys are interested in covering these things, what we can do is try to arrange to cover between ourselves, see who can cover which, and we can discuss them in detail. Obviously, as you're aware of, we have different pathways that we went through. We can give you a guideline, an idea about how to get in, and give you all the important resources that you need to go through so that you know when you're applying to these different specialties what you need to be doing. But we can definitely give you a broad idea about how to apply for these different specialties. So the academic training, basically, if you can visit this website, you will know more about this. But basically what's expected in academic training is that, as you see in medical school, some people here, while they're doing medical school, they do another bachelor or another master's. They take 1 year off and then they do that and then they come back. So this is something that people who are studying in UK can do. Otherwise, another thing that you can actually do after finishing med school is getting into a master's degree. I have done that myself. And because I know some of you had questions about that, basically it's one, if you're planning to have a bit of involvement in academia, it will be very good for you to have a master's degree. 2, when you apply to a training job, one of the things that you actually get scored for is having an academic degree. So if you have an MD, which is MD here is like a 2 years research degree before you get to a PhD. So basically, if you have an MPhil, MD, Masters, which is a 1 year in UK, you actually get higher scores just for doing that. From my personal experience, doing a master's, I myself am interested in academia, but generally I think if the master's that you're going for actually has a bit of a taste of how the NHS works. So for my example is the master's that I did, which is Master in Clinical Neurology. My master's was done in the University of Sheffield, and basically for those of you who are interested in neurology, basically, there are more than one university that actually offers this, including Imperial, UCL, Sheffield, Oxford. But for something that you need to be aware of, if you want some clinical experience, Sheffield offers this even if you haven't got any GMC registration. So for me, we had around 6 months of modules, and it's basically, learning all about different kinds of neurological conditions, and it's very extensive. You get tested on that, and they also work with you about, research skill, presentation skills. So there are many different activities to assess you, which is very good. It really helps you become, better equipped with these things, which are expected from you when you are in training. So, journal clubs, involvement in research, audit, knowing how to criticize a paper. These are things that are really expected from you when you start your training, even if it's not academic. They would expect you, it's not a mandatory thing, but they expect you to be slightly involved in that, know how to do that. So that gives you a good background. And then for me, what happened after is that I have a mini thesis. The thesis is usually 10,000 words. Mine was around 6,000 to 7,000 words. But because I also have to do a clinical attachment in a specialty or subspecialty in neurology. So I actually had 4 months of clinical attachment, and they actually allowed me to have a bit of a hands-on, not extensively because I don't have registration. There is a limit to that, obviously, but it really exposed me well to how the NHS system works. I actually formed a portfolio because that's expected from me to graduate, a clinical portfolio and everything that I've done, which also is very good when they see it when you apply for jobs, that you have done a clinical portfolio, you're exposed to the NHS system. And as I told you, the added benefit of that, when you apply for training, it gives you a better score. And if you're planning to do an academic career later on, this is a very good start. There are things that you need to consider when you apply for masters. I'm going to discuss that in the next slide, which is almost the last slide now. But after that, from a foundation perspective, you can actually apply to something called academic foundation year, which basically puts you in or gets you involved 25% of your time. So you have like research blocks, like 1 to 2 months per year, actually 3 months per year, where you get to explore different research methods, build an idea of what you want to do if you want to apply for PhD. So this is a very good start. And then if you don't want to apply for that, you want to apply when you start the medical training, that actually there's something called Academic Clinical Fellowship, or ACF. Basically, you can apply for that when you apply for the internal medicine training. And basically, you can apply either at the first or the second year. It doesn't really matter. So you can start off as a clinical trainee and then apply for that. What is nice about this is that it guarantees you a training number in the subspecialty, because it will be themed around the specialty that you're planning to apply for. So if you want to apply for cardiology, it will be themed specifically to help you have more academic knowledge and experience in that. And you will be going straight through. They'll make sure that you don't have to apply again. You'll get a training number in the subspecialty you want. So when you start this academic fellowship, you are guaranteed to finish with a consultancy job in the same area. So that's something that's also appealing in terms of, you get a training number in the subspecialty already, even if you're applying as an internal medicine. Some people, again, don't want to do it at that time or don't manage to get in at that time. These are pretty competitive. So you need to have a good academic CV. You need to show them that you're involved in research, you have publications and so on and so forth. So it is a competitive post. It is funded. So they actually help you. You get 3 months a year. You get into research, you build an idea so that they actually fund you completely 100% to do a PhD. And you get an out of program PhD, you stop your training, you can get a bit of clinical exposure in between, you finish your PhD, you come back and your seat will be saved. They will finance you completely 100% when you do this. So this is something that some of you might want to think about if they want to have a bit of both. If you don't manage to get into the first 3 years, you can get into clinical lectureship, where it's 50% research and 50% clinical. And basically, you can also do more research projects and get involved in larger research projects, get to teach and be involved in academia. After that, you get your, CCT, which is a consultant post. You will be, board certified in the subspecialty that you want. And you get an academic position as well. So you can become a senior lecturer, continuous professional development associated with that, or a senior clinical fellowship after that, where you have a subspecialty in detail that you want to work on as research. So this gives a general idea about the academic training pathway, if any of you is interested in that and interested in doing a PhD and actually getting through something that will expose you to the subspecialty you want, and you get a number, so you don't have to reapply. You get directly a number for the subspecialty you want. So these are the benefits of actually getting into that. Obviously, if you are interested in having time for research and teaching. Otherwise, having a master's or academic degree, I discussed with you what are the benefits. Choices really depend on what you want to go for. There are many masters in neurology, cardiology, radiology, and there are some of them that are specific to radiology, like neuroradiology, MRI imaging specifically, for example. So there are many different choices really tailored to what exactly you want to learn about. Some of them, as I told you, have a clinical aspect to it. UCL does have a clinical rotation. However, you need to have had 2 years of experience and have a GMC registration. Some of you might not have had that when you apply, but this is something that you can consider. And there are scholarships that you can apply to. Actually, there are some scholarships for the university where you can get from 25 up to 50% off from the tuition fee. And there are outside scholarships. You need to search them. They are from, some of them are from the British Council, some of them are from the Wellcome Foundation, and some of them are specific to, you know, people from different countries. They can actually be funded. So you can, you know, have a run through all these different scholarships and see what fits with you best, basically. That question I think I've answered. Is it beneficial to start training directly? It just overwhelms you. There is no right or wrong, but I would say, again, have some bit of experience as an on-training, especially if we are talking about training as an internal medicine. If you're going as an FY2 training, I think it should be fine. But as I told you, the time of constriction and the English test scores. Otherwise, if you want to jump directly into internal medicine, I wouldn't recommend that, or surgery. I wouldn't recommend that because you need to be familiar with the system so you can smoothly go into the training without struggling, because you already need to be familiar also with what are the prerequisites, what do you need to sign off during internal medicine, which we will discuss in detail. But you need these all, you need to be aware of at such a short period so you can start preparing yourself. So not being familiar with the system would really be overwhelming. So that's why we always say start with an on-training job. And that basically means don't go rushing into internal medicine training or surgical training. Have a non-training year or a training as an FY2, but don't jump directly into the specialty training. That's what we mean, basically. Can you do an oral and maxillofacial surgery, or will that be included in the surgical talk? That will be included in the surgical talk. This is one of the subspecialties I think you can go through after core surgical training. Most of the surgical subspecialties, you need to do core surgical training, except the ones that I've mentioned, which we will cover. Both me and Abdullah will cover it for you guys as much as we can, obviously, with what we know. But this will be covered more extensively with Abdullah, inshallah. Do we apply for the academic pathway instead of the clinical one, or along with it? You need to have 2 interviews when you apply for the academic. There is an interview which is going to assess your academic capabilities. And if you pass that, that's great. But you need to also pass the clinical benchmarking, which is the interview for the internal medicine itself. So the internal medicine interview will basically, I'll discuss obviously that in more detail. It will include, you know, your clinical sense, your clinical experience, how you manage clinical scenarios. So they need to assess that in order for them to say, okay, she has passed that. She's also passed the academic, or he's also passed the academic assessment. They'll be good to go. They are eligible to be, you know, to be put as an academic fellow. But I think that if I'm not mistaken, you need to apply for both of them so that you have both interviews, and then you get offers for both of them. Once you have passed the internal medicine interview, you will get an internal medicine post offer, and you will also get the academic offer, and then you can choose either of them. But I think you need to have to apply to both of them so that you actually get the interview for both, because it's important to have both in order for you to start the academic clinical fellowship. Any further questions about any of what we have discussed, or anything about the academic pathway or masters in specific? The next thing would be the internal medicine matching process, and that will be the next talk that we will have. I will discuss everything in detail, what you need to do, and basically what is expected from you as an internal medicine trainee or a resident. That will be covered in the next talk. So I'll make sure that you are fully equipped on what to do to maximize your chances to get into a competitive post, and what you are expected to do as an internal medicine trainee. What are the prerequisites that you need to be doing during your training, and what is expected from you. I covered like generally what you need to do, but we will have that in more detail once we discuss the internal medicine matching process. So that would conclude my talk. If you have any further questions about anything we have discussed or anything general that I can answer you guys with, I would be more than happy. So we'll leave the chat on. I'll give you a few minutes to think if you have any questions as well, so we can answer them. Thank you so much, guys. This is the least we can do, honestly, because I understand you hear different, backgrounds and different things about UK. And it's important for you to get all the information that you need about the training here so that, you know how to prepare for it very well, because it can be a bit ambiguous just because not a lot of people has gone previously and trained in UK. So I really hope that all this series is quite helpful for you in actually having a very comprehensive idea of how the training is like, so that you know how to prepare yourself and be a competitive applicant. And trust me, wallah, like all of you graduates from Alfaisal will be a very competitive applicant, because mashallah, most of you are largely involved in a lot of things, including teaching and research. So I don't need you to worry about getting even into competitive specialties. You just need to know how to manage your time, prepare yourself, know what are the desirable criteria, and you should be fine. And as I said as well, the visa aspect also is something that probably people with different individual circumstances have had some issues with. But once you know what you need to supply, once you know what you need to say in the visa, the likelihood of you getting rejected is also minimal. So it's just really knowing details. And as I told you, some people have individual circumstances that affected them, but that doesn't necessarily mean that everyone will have the same outcome in terms of visa or in terms, just you need to be aware about all the details before you do any of this, and you should be good to go. If you are Canadian, why study in the UK? So I'm assuming if you're Canadian, you will either apply for training in Canada, which my understanding is a bit difficult, especially if you want to do, competitive specialties. I understand the internal medicine and family medicine, relatively straightforward if you're Canadian, but otherwise it might be a bit difficult. You can go for US. But, in UK, I think it really depends largely on what you're expecting out of your training. US training is very good in certain aspects. UK training is very good in certain aspects. You can go to either, but if you're planning to go to Canada, it's largely very highly unlikely that you get into competitive specialties. It's just very difficult there as far as I'm aware of. US also—
Can I say something, Lynn?
Sure.
So Canada. So any Canadian who studied abroad, they are not considered Canadian. They are considered IMG. They are competing as IMGs. So you're not Canadian. You don't have advantage if you are Canadian studying abroad. So that's where the difficulty comes. Sorry.
It's okay. So as he said, basically you're considered an IMG 1 and 2. In Canada, it's really difficult to get into competitive specialties. It's just the number of posts they have is really minimal, and to get into the system is very difficult. Again, the choices would be to go to US or UK. Again, it depends on your personal circumstances. What are you expecting out of your training? And personally speaking, again, you need to look at generally, and a personal advice from me to you, you need to look at what you are seeing yourself in terms of personal circumstances. So for all of you, I think you're very aware, US is really, really, really hectic throughout the time of training that you have. The number of hours are very long, and you need to know that for that 5 years, a chunk of 5 years, you will be pretty limited in terms of time and, being able to travel to see family until you finish the residency. In UK, there is a bit more flexibility in terms of you can do a non-training job. You can actually, have maternity leave that lasts up to 6 months to 1 year. For those of you who are females, they give you you get a paid maternity leave for up to 1 year. and it doesn't take away your training post. You can actually come back after you've finished your maternity leave and start and continue where you left off. The number of hours that you work doesn't exceed 50 hours per week. In US, as far as I'm aware of, in some of the states, you still have to work at least 80 hours per week. So honestly, the choice of why to go for either, I'm talking in general, Canadian, as Abdullah answered you, but generally, you need to think of all of these things when you're choosing where to go for residency for. These are important things to some people, and they don't mind having a longer training if that's the case, that they can get some time off during maternity, or they can do a non-training job, finish off exams, come back to training. These are things that you need to consider when you are applying, because you also want to be comfortable in the environment you're in. You want to be comfortable in the process, because wherever you do, residency, it is hectic. But depending on your priorities and what you are expecting as an outlook in the next 5 years, you get to know what would be the best choice for you. Some people would rather have 5 years, finish in a shorter period and get to become a consultant. Other people would rather have a bit more time, especially if you need to go on leave for any reason, including maternity, you have the opportunity without losing your training post. The flexibility in actually flying back and forth in UK is easier than US. This is something that I'm just mentioning because I do get a lot of questions on that. It's much easier to actually travel around if you need to see your family, if you're if you're doing it in the UK. In the US, it might be a bit more tricky just because you need to reapply every time you go out. These aspects are sometimes important to some people, and they would rather have a longer training period than having a shorter period, but having these aspects missing. So I would say, honestly, there is no place where the training is better than the other. It's just, what is your preference? What is your personal circumstances? And what is important to you on the long term? But otherwise, to be honest, I don't think there is a huge difference in how the training is in US or UK. There are a bit of differences, obviously, but there isn't a huge difference. Both of them are very well recognized, and you can work with these boards in any place you want. It's just that this is for you who are now applying or thinking of where to apply. It's important to sit with yourselves and think, what would be good for me, what I would be comfortable with on the long term. If you want to plan a family, you need to think about all of these things and what is priority to you in the next 5 years. Once you do that, you will easily be able to decide which one to go for and which one is more suitable for you. Obviously, if you are very passionate about a specialty, please go to a place where you actually can get it, because if you're passionate about something, just pursue it in the place that can actually provide it to you. And work on your CV to maximize your chances wherever you go. So it's hard to get into any place if it's a very competitive specialties, but if you work on it from the beginning, work on your CV while you're in med school, when you don't have that many responsibilities, you will be able to get what you want. But honestly, just sit with yourselves and put the priorities. That will make it very easier for you to also decide where you want to do your training, generally speaking. Is it true that UK pays doctors less than US, taking living expenses into consideration? Okay, so this is another thing. As a trainee, you're actually paid the same. So when you're in residency, my understanding is that you don't have a large difference in the payment scale. Actually, when you start off in the US, you get paid less than in the UK. But as the residency progresses, you get paid, I think, my understanding, and Abdullah, correct me if I'm wrong, I think my understanding is that the payment is almost more or less the same. However, when you become a consultant, this is where the payment is a lot more. In US, it's a lot more than UK, I can tell you that. But in both places, the taxes are there. Actually almost half of your salary goes for taxes, whether you're in UK or US. But again, it depends on whether you're planning to stay long-term in places like UK or US. If you're planning to...
And live away from London.
Yeah. The one thing about London, and I think Abdullah will agree with me because I'm also living in London, it's really, really, really expensive to live in London. It's not easy to save up if you're starting off in London. what you need to know, as you start off, you get 20% off from your salary because of tax. So you need to also be good in managing your payments. Obviously, it's less heavy financially if you go to other places outside London. London tends to be, it's one of the most expensive, cities to live in. After that comes Oxford, and then the rest of the cities. So this is something that you also need to be aware of. If you are planning to save more money and you don't really necessarily want to be in London for any reason that is, then go for somewhere outside London and Oxford. Otherwise, if it's important to you, London has the central national research centers, and Oxford does too. So this is also something to keep in mind whenever you're applying for something, especially I would say if you look at your specialties, because some specialties have centers that are known nationally, not necessarily in London or Oxford. So when you're looking for your specialty, make sure that you go for the centers that are actually well known on a national basis, because I think that will give you a very good experience if you go for these. So these are things you need to also think of whenever you're applying. But would someone get paid extra if living in London? Yes, so you get paid extra 2,500 almost per year, which is equal to 200 per month, because they're aware that it's more expensive to live in London, so they increase the scale a bit. Obviously, it comes down if you're living anywhere outside London. I don't think that applies to Oxford. It's just London that you get more payment to cover for your expenses. But generally speaking, it depends. The money that you get as a resident is almost the same, whether it was in US or UK. After that, when you become a consultant, if you're planning to stay in US and money aspect is something that you have, as your priority, then definitely being a consultant in US pays a lot more. Although we need to calculate the taxes there. So taxes are present either or. If you're planning to just finish your training and come back to any of the countries like Saudi, Dubai, and so on, then it really doesn't make a difference. You'll get, I think, paid almost the same. It just really depends on whether you're planning to settle down in UK or US or not. But this is only at a consultant level, not at a training level. Do you need me to cover anything else? You can also still pop questions as we go along. As I told you, the talk is finished, but if you have any questions about, any general questions about the training or the life in the UK, or the things that we have covered earlier, I'd be more than happy to answer. Can I do a fellowship in the US after British board? Yes, you can. If you finish your step 1 and step 2, you can. So the most important thing when you do a fellowship in the US is just to be sure that you are licensed there. Having said that, if you're planning to work in US after, you'll be a bit limited. I think some states wouldn't allow you to have a clinical based work. Some of them would, because you didn't have your training in the US, you just did a fellowship in the US. So it might be a limitation if you want to continue after that in the US, but otherwise you can actually, finish your training in the UK, have your steps ready, so that you can apply for a fellowship in the US. And that's something that some people actually go for, because, in US, there are more specific fellowships that you can actually specialize in. In UK, there are, you develop your own subspecialty of interest rather than them having a fellowship, and they allow you to spend more time during your training on that subspecialty of interest. Can you work in Canada afterwards? That I'm not quite sure. I don't know if Abdullah is aware of that, but because I'm not sure to be honest.
I think I'm not sure as well, but I think Australia and Canada accept UK qualification to work after completion, like CCT. I think Canada and US, they recognize it, but I'm not sure, to be honest.
For Australia, Canada, to be honest, I'm not sure. We can check for you guys and let you know later. But for Australia, since you mentioned Australia, a lot of people are actually start in the UK and then move to Australia. Some people want to start off in Australia, but it's a bit more difficult to get into the system there. They do a couple of years in UK and then they move to Australia. That would be a much straightforward way to do it. especially for people who already have, for example, Australian passport or want to live in Australia, they have family there. And in terms of payment, generally, if some people, want to know about these things in detail so that they know their options. In Australia, the payment is better, and the number of hours might be, it's considerable, I think, according to different specialties, because sometimes it can be much more hours to work. Some of them might be a bit less hours to work. It depends on the specialty in terms of hours, but my understanding is that you get paid more if you are a trainee in Australia. So that's something that you may want to consider afterwards, but because they share more or less the same system in Australia and UK. But again, this is really according to individual circumstances, what are your preferences, but I'm just telling you all of these things so you have this in mind whenever you're thinking about where to go for. Any further questions I can answer? How can we contact you if further questions arise? So these are, you have two emails that you can contact me on, the NHS email and then my Gmail. And you can also contact me on my Twitter account if you have any further questions, and I'll be more than happy to answer. Please always ask so that you have a comprehensive idea about what you're applying to. I think the more we have talks in this series, the more you have a very good idea about how it is to train in the UK. But feel free to contact me at any time and I'll answer you with everything that I know already. And if I don't, I'll either direct you to the person who would know, or I would give you a link that you can, go through so that you know what you're expected to do in different specialties. But we're all here more than happy to help you whenever you have any questions.
Thank you so much, Doctor, for the wonderful talk. It was indeed extremely beneficial to us and to the audience. To everyone in the audience, again, we hope you found this talk as informative as we did. Also, I'd like to thank AMBOSS for their constant support. For constant updates on our upcoming webinars in the CGS UK series, do make sure to follow us on Instagram and Twitter. And in case we get the recordings uploaded on YouTube, then do subscribe to our YouTube channel to get the recordings, for which we will paste the links down in the chat right now. Also, if you want to contact the international office anytime in the future, you can contact us through our website, or you can also use the WhatsApp number pasted in the chat below. Again, before you leave, thank you, Dr. Lin, and everyone in the audience once again. We hope to see you all in our future webinars. Have a wonderful day. Thank you.